After surviving a heart attack, many face a difficult question. Should I rest to protect my heart or move to help it recover? Recent research shows appropriate exercise is essential for preventing recurrence, recovering heart function, and improving quality of life after myocardial infarction. This is about scientifically designed movement that rebuilds your heart's capacity safely. After a heart attack, even with restored blood flow through procedures like PCI or medication, cardiovascular function doesn't automatically return to normal. Rebuilding blood vessel function and improving cardiac output requires exercise stimulation. The microcirculatory system often isn't fully opened at rest, only recruited when metabolic demands increase with activity. This coronary flow reserve can be improved through exercise. Research by Yamamoto in 2018 showed continuous moderate intensity aerobic exercise significantly improved coronary flow reserve in post-heart attack patients. Heart rate reserve, HRR, is crucial in cardiac rehabilitation. It's the difference between maximum heart rate and resting heart rate, showing how much room your heart has to increase its rate. If maximum heart rate is 160 and resting rate is 70, HRR is 90. When setting exercise intensity, working at 40 to 70% of HRR is scientifically recommended. Research by Cole in 1999 showed patients with low HRR after heart attack had higher mortality rates. HRR is both an exercise guide and physiological predictor of long-term prognosis. Excessive rest after heart attack can create new risks. Prolonged rest causes rapid skeletal muscle loss, decreased basal metabolism, and autonomic nervous system imbalance. Extended bed rest significantly reduces basic muscular, endurance, and cardiopulmonary function needed for daily life after discharge. This especially affects elderly patients, increasing susceptibility to sarcopenia and frailty. Conversely, appropriately timed and intense exercise contributes to heart function, reconstruction through improved coronary circulation, recovered heart rate reserve, and autonomic readjustment. Current guidelines recommend starting light physical activity within 48 to 72 hours after the acute phase. Cardiac rehabilitation, once supplementary care, is now central treatment strategy, alongside drug therapy. A 2016 Cochrane database systematic review showed participants experienced approximately 13% reduction in all-cause mortality, approximately 26% reduction in cardiac death, decreased hospitalization, and improved quality of life. Cardiac rehabilitation works complementarily with drug treatment, effectively managing cardiovascular risk factors. Exercise is particularly effective for metabolic abnormalities like insulin resistance and low HDL cholesterol. Autonomic nervous system balance is an important prognostic factor. Cardiac patients often maintain sympathetic dominance, increasing risks of arrhythmia, reinfarction, and sudden death. Aerobic exercise stimulates the parasympathetic vagus nerve, improving heart rate recovery and heart rate variability, or HRV. HRV represents fluctuations in heartbeat intervals, reflecting autonomic activity. Low HRV strongly correlates with mortality, while increased HRV balances sympathetic and parasympathetic nerves, maintaining stable circulatory dynamics. Research by Monk in 2014 showed 10 weeks of moderate intensity. Aerobic exercise significantly improved HRV with decreased depression scores. Exercise therapy mainly includes aerobic exercise, like walking and cycling at 40 to 70% of maximum oxygen. Uptake or heart rate reserve, 3 to 5 times weekly for 30 to 45 minutes, improving coronary flow reserve, lipid metabolism, and HRV. Resistance training at 30 to 60% of one repetition. Maximum 2 to 3 times weekly improves skeletal muscle metabolic capacity, prevents sarcopenia, and supports blood sugar control. Respiratory muscle training helps those with severe breathlessness. Monitoring exercise intensity and ensuring safety is paramount. Heart rate targeting 60 to 70% of maximum heart rate reserve. At 40 to 60%, rating of perceived exertion or RPE at 12 to 14, which feels somewhat hard, and keeping systolic blood pressure under 180 during exercise are important indicators. For patients taking beta blockers, where heart rate becomes unreliable, RPE functions as an objective guide. RPE asks how tired you feel on a scale of 0 to 20, correlating highly with heart rate and oxygen uptake. RPE values of 11 to 12 feel somewhat hard, 13 to 14 feel moderately hard, suitable for cardiac rehabilitation. Post-heart attack exercise prescription uses submaximal rather than maximal load for safe and effective exercise. Submaximal means exercise levels with room to spare before reaching maximum. This is crucial because excessive heart rate, elevation, or blood pressure response could cause fatal complications. Standards include 40 to 60% of heart rate reserve, 50 to 70% of maximum oxygen uptake, and RPE of 12 to 14. Regular moderate aerobic exercise at RPE 11 to 14 produces increased parasympathetic activity, decreased resting heart rate, decreased stress responsiveness, and improved sleep quality. Breathing approaches are effective alongside exercise. Diaphragmatic breathing at 6 to 8 breaths per minute, inhaling for 4 seconds and exhaling for 6 seconds, or mindfulness breathing help improve HRV, heart rate recovery ability. How quickly heart rate returns to resting level after exercise is another important prognostic indicator. Normally, heart rate should decrease by at least 12 beats in the first minute after exercise ends. Post-heart attack rehabilitation requires individually optimized programs tailored to recovery stages. Immediately after discharge focuses on regaining confidence, with walking and stretching at RPE 9 to 11. Recovery period from 1 to 3 months focuses on improving heart rate reserve, with aerobic exercise at 50 to 60% of HRR and resistance training. Maintenance period beyond 3 months focuses on expanding daily activities with regular moderate exercise. The hardest part isn't starting but continuing. Only 30 to 40% maintain exercise habits after 6 months. Barriers include feeling exercise is unnecessary. When symptoms improve, psychological resistance, anxiety, that movement might harm the heart, and not feeling benefits. Overcoming these requires behavior change models and psychological support. Self-efficacy, believing you can do it, is crucial. Building it involves accumulating successful experiences, seeing success examples from similar situations, receiving encouraging words, and controlling physical and emotional states. Technology supports continuation. Apps visualize exercise records, providing achievement feelings. Wearable devices offer real-time monitoring, detecting overload or arrhythmia immediately. Social support matters tremendously. Exercising with someone shows higher continuation rates. Having an exercise partner, peer support groups, and regular professional follow-up all facilitate behavior change. For those who've experienced heart attack, starting to move again sometimes becomes a major challenge. However, with scientifically based safe exercise, prescription, and systems supporting behavior change, the body certainly changes. Exercise moves not just the heart, but also the spirit. Please subscribe to our channel and hit the like button. Thank you for watching. Please subscribe to our channel and hit the like button. Thank you for watching.